Does your pet have a swollen and painful ear? Join me, I'm Dr. M. Welcome to VMC. Today we are going to cover the common causes and treatments for oral hematomas. Join me, you'll learn something today. So first, we should cover what an aural hematoma is. AURAL refers to something to have to do with the ear. Hematoma is when a blood vessel ends up getting damaged and broken and bleeding has occurred within a tissue. So an aural hematoma is when this has occurred on the ear flap of one of our cats or dogs. The ear flap or pinna may be partially or fully filled with blood on one side or the other. The extra weight of that ear flap is often quite uncomfortable to the animal, and it can also cause damage to the cartilage within the pinna. An aural hematoma will often feel warm, at least at the beginning, soft, a little bit like a balloon almost. Now, these are more common in dogs than they are in cats, but they can happen in both species. So common symptoms that you need to be on the lookout for are head shaking, scratching at the ears, tilting the head abnormally, carrying the ears in a different position than is normal, and just the change in appearance to the ear flap itself. So the ear flap is essentially a layer of cartilage that is sandwiched between skin on either side, and there's a lot of blood vessels that go through there as our pets use those as part of their temperature regulation system. And they will dilate those blood vessels in an attempt to lose some heat from them when they're too warm and constrict them when they're cooler. So if you get something that irritates your dog or cat's ear, they will respond by shaking their head or scratching at the ear. This can cause damage to the blood vessels within the ear, which then can lead to the aural hematoma. So commonly we see aural hematomas occur because of trauma, like a bite to the ear, or because of ear infections or ear mites. They might also have a foreign body in their ear causing that irritation, or it might be because they were doing a normal shake of the head and their ear flap ended up hitting something. Less commonly, we can see aural hematomas secondary to some diseases that cause blood vessel fragility like Cushing's, or it might be because of something like a bleeding disorder or a clotting disorder. The most important thing when it comes to aural hematomas is that we investigate why it occurred in the first place and do a proper medical workup to find that underlying cause. Unless we treat that underlying cause, we will not be able to fix the aural hematoma. So generally we start with a physical exam to look for any signs that they might have unexplained bleeding or clotting issues elsewhere on their body. We would also carefully do an exam of their ear and down their ear canal all the way to their eardrum, because we're looking for potential issues like foreign bodies, inner ear infections, external ear infections, ear mites, and the like. Then we should also take swabs of the ear. This is called ear cytology, and we look at those samples under a microscope in order to check for ear mites and ear infections of various types. If your animal is experiencing frequent ear infections, often we have an underlying allergy issue, and so that may need to be investigated as well. If all of those issues have been ruled out, then we may also check blood work in order to look for different endocrine issues like Cushing's, or to check for issues like having low platelets or clotting problems, and so on. For our feline friends, ear mites are going to be one of the most common causes of aural hematomas because those ear mites are so incredibly itchy. On the whole, we will see more aural hematomas in dogs than we do in cats, and I wonder if that has to do with the shape of the ear pinna between the species. Our dogs are more likely to have bigger ear flaps or folded or floppy or hanging ear flaps, and our cats, they have such small and upright ears. They just seem a little less prone. I'm going to reiterate this because it truly is the most important thing that you need to know about oral hematomas. When it comes to treatment, the most important thing that we must do is figure out the underlying cause of the hematoma and address that. If we don't do that, then anything we do to secondarily address the current oral hematoma is really essentially a waste, because the animal is going to keep traumatizing their ear flap and keep having the oral hematoma occurring or reoccurring. Now, when I was going through vet school, we were told really only about a bunch of very invasive surgical techniques in order to address the oral hematoma, and it usually meant general anesthesia, cutting into the oral hematoma, and then doing a variety of different techniques in order to try to tack the ear skin to the ear cartilage when through the skin on the other side. But of course, every time that you puncture through that cartilage, you get more bleeding and more risk of more oral hematoma forming. We've had more research recently showing that less invasive techniques are generally recommended and preferred for most patients, especially if you catch the oral hematoma issue early. In some situations, we don't have to do any sort of draining procedure or surgical procedure on the ear at all. There are some cases where we can give oral steroids, treat the underlying cause, and put something called a no-flap ear wrap or some sort of similar idea on the dog to prevent them from shaking their head around and causing more trauma to the ear. Because the steroids will help to reduce any inflammation that was contributing to the bleeding that was occurring, that and treating the underlying cause and preventing more trauma to the ear will often fix the problem. And over time, the body will absorb the blood that has pooled on the ear flap. Now, this can take some time for the oral hematoma to heal, and the one downside of this that we aren't even sure about because we don't have enough research on it yet, but it's possible that you may end up with a little bit more of a crinkly appearance to the cartilage of the ear. Maybe. And especially for patients where cost is a concern or where we don't want to use sedation or anesthesia, using this technique is excellent and it's often very successful. I tend to use this the most often for most of my oral hematoma patients, and it works like a charm the majority of the time. Now, if we have a really large oral hematoma where the case is more complex or we cannot give oral steroids necessarily, then we may end up having to do some sort of surgical procedure on the oral hematoma. The most recommended procedure with the best outcome is where we drain the oral hematoma and we actually inject a steroid locally into the area. Again, this procedure must be paired with treating the underlying cause for the oral hematoma in the first place, using bandaging or no-flap ear wraps to prevent trauma to the ear while it's healing. We have to use pain management, of course, and often we will even give oral steroids along with that treatment plan to these patients as well. The research we have on treating oral hematomas shows that this is a very popular technique as well, and it tends to have really good outcomes too. The challenge with this procedure is because you've just drained the blood out of the ear flap, there is an empty space there, and we do attempt to fill that with that steroid that we put into the ear itself. However, there is a risk that it may just refill up with blood, and so there's a little bit of a debate about whether this draining is even necessary in the first place. Also, if the hematoma is a bit older, there might be enough clotted blood there or even like fibrous tissue as the body's trying to heal itself that we might have a hard time draining the hematoma. So there are some cons to this, and of course you do need anesthesia as well for these patients in order for them to be still while we do this procedure and to control any pain that the procedure might cause. Now, it's pretty uncommon nowadays, but there may be rare situations where we have a very resistant or challenging oral hematoma that just really doesn't seem to want to heal. We may consider a more invasive surgery in these situations, but these tend to be pretty uncommon, and we really should use the less invasive techniques that are shown to have the best outcomes first before we move on to considering something more invasive. The post-treatment care will vary quite a bit depending on what your veterinarian finds was the underlying cause for the oral hematoma. I did a video where I covered ear infections pretty extensively, so I'll make sure to link that in the doobly-doo for you if you want more information on that. Otherwise, if it's one of the other less common causes, your veterinarian will discuss what an appropriate treatment plan and follow-up plan is. It will be very important to have follow-up visits with your veterinarian to assess how well the treatment plan for the underlying issue is going, as well as how well the treatment plan for the actual oral hematoma is going as well. Now, no matter which treatment plan is done, there is always a risk that we get some scar tissue, some thickened cartilage, or some wrinkling to the cartilage of the ear. So no matter what treatment plan is done, it is possible to have that as part of the outcome. The good thing is that this is generally a cosmetic issue, just changes your pet's appearance a little bit and doesn't seem to bother the pet, which is great. If you've followed VMC for a while, you know how important prevention is to me, and so I always want to include information for you because I'd rather that you prevent oral hematomas than end up having to treat them for your pets. As far as prevention goes here, it really does mean doing things like checking your pet's ears regularly, discussing if ear cleaning is necessary. If you notice that your pets are prone to having dirty ears or waxy buildup in their ears, we might also have to use ear cleaners after bathing or swimming in order to remove moisture from the ear canal. And if you note that your pet is shaking their head a lot or scratching at their ear a lot, it's prudent to see your veterinarian sooner rather than later. If you treat whatever is causing that irritation, pun intended, before the oral hematoma happens, that's better for everybody and is a win-win-win all around. So make sure that you seek prompt veterinary care if you notice your animal's having a problem with their ear. Oh, you okay? If you have a topic you'd like me to cover in a future video, please comment that down below. I love to hear from you. And if you have any questions about oral hematomas that I didn't address, please let me know those as well. I do put out a new video most Fridays, and I cannot wait to see you in the next one. Bye! Oh, you okay? You got another sneeze in there? Do you need to go get some water? Good girl. Oh.